how I envision my role in this field is primarily as an oncologist who also uses surgery as one of the tools to treat patients. My name is Stephanie Greco, and I'm a surgical oncologist at Fox Chase Cancer Center. I treat patients with both gastrointestinal and skin and soft tissue tumors. So this includes patients with colon and rectal cancer, cancer of the appendix, stomach, and other parts of the intestine, skin cancers such as melanoma and sarcomas, including gastrointestinal stromal tumors, as well as patients with peritoneal malignancies, which can arise from the appendix and other organs. So when I talk to a patient, we talk about what are the different ways that that operation can be done, and then we'll review whether or not that patient is a candidate for an open procedure or a minimally invasive procedure, such as a robotic type of surgery. The goal of robotic surgery is really to reduce size of incisions and earlier return to bowel function. I also do some more unique procedures that are not done at every type of center or even cancer center. One of those is called HIPEC, which stands for Hyperthermic Intraperitoneal Chemotherapy, which is essentially a chemotherapy wash that is used at the time of surgery for patients who have what are called peritoneal-based cancers, which is when cancer spread to the lining of the organs inside the abdomen. But it can be particularly helpful in several patients with these types of tumors. Our field is really multidisciplinary, and my job as a surgeon is not just to know when and how to operate on somebody with a specific type of cancer, but also to know what other treatments and what sequence of treatments should be provided or offered to a patient as well. Research is very important. We really need to work together. This is part of the team approach, to work with the scientists, to work with the medical oncologists who give chemo, the radiation doctors, all together to really come up with good research plans and ultimately develop clinical trials. When a patient, first has a cancer diagnosis, obviously it can be a very scary time in their lives and really is life-altering. I think one of the most important things is to make sure that the patient realizes that we have an entire team here of resources and treatment available for them, and that is my job to facilitate access to all of these resources. It's very satisfying when we can have a successful operation, tell a patient that they are cancer-free, and overall just an honor and a privilege to see patients and their families and take care of them.